And welcome back to Talk of Alabama. Whether you're active yourself or you've got maybe children involved in sports, it's always important to watch your health and be aware of possible injuries. Here to share more about sports hernias is Dr. Benton Emblom with Andrews Sports Medicine. Welcome to you.
Thank you.
So tell us exactly what a hernia is to begin with.
Well, a sports hernia is completely different than a regular hernia, and that's the common misconception or misnomer, rather. A hernia, in the classic sense, is what people think of when they go see a general surgeon. They have a bulge or a pooch or something like that. But a sports hernia is nothing like that.
Really?
The reason it's called a sports hernia is because you see it in sportsmen or athletic or active patients or individuals that develop symptoms that are classically similar to that of a hernia: groin pain, pain with straining or explosive type activity. And the workup for a true hernia is negative, so it's just called a sportsman's hernia. That's where the name originated. The true name ought to be more athletic pubalgia or core muscle injury, but basically what it is a muscular and tendon injury in the pelvis that kind of mimics the symptoms of a true hernia. So that's how it got named a sports hernia.
So I know how they go nowadays. My brother just had a hernia a couple weeks back, and he sent me a picture, and they had 3 little holes kind of in his belly area where they didn't really cut him open. That's a normal hernia, I would guess.
That's the newer treatment for a normal hernia that they do laparoscopically from inside the abdominal cavity. A sports hernia is treated completely differently.
That's what I was going to say. So then how, in comparison, would a sports hernia be treated?
Right. A sports hernia basically is just the breakdown of the investing layer of tissue that surrounds the lower abdominal muscle and the groin muscle. Okay. So athletes that have explosive rotational movements, whether they're competitive athletes or just extremely active in terms of working out, can damage those structures and lead to the symptoms that you see with a sports hernia. So to repair it, you actually repair the disrupted tissue and, in effect, rebalance the disruption that has taken place in the pelvis.
So does that actually mean surgery opposed to like a physical therapy?
Correct. Some you can treat with physical therapy and or injections, and we have had some success with that. But the patients that are really high demand, I even hesitate to say the patients, because, I mean, they are patients, but we think of them as athletes, are, you know, the really high demand individuals, and in order to repair that, you have to physically go in and repair the injury. You know,
is there a way to prevent this? Because obviously if they're getting it through athletics, then that's, say, what maybe for a professional athlete, that's what they do every day for their job.
Right.
How would you prevent? Is there a way?
It's sometimes very difficult, but we think we've kind of figured out how to prevent these types of injuries by focusing more on core and hip strengthening. Just like any other muscle tendon injury, if there is a weak link, it's going to be there in the muscle and the tendon unit, and if you can strengthen that and keep it from disrupting, you can sometimes prevent these.
And as far as recovery time?
Pretty brief, you know. I mean, we've had athletes at the collegiate football level go back within 4 to 6 weeks after surgery.
Oh, very nice. So for more information, they can go to andrewsportsmedicine.com?
Correct. We have a website, and I have a specific section within the website that addresses sports hernia itself, so that is a good resource for people.
And I assume this is men and women, right?
Correct.
Any athletic?
I did 2 yesterday, 1 in a man and 1 in a woman, so it can happen in both sexes.
Well, I'm glad I'm not an athlete then. No, I'm joking. AndrewSportsMedicine.com for more information. Again, there's the website. Contact them if you think you could possibly have a sports hernia or for any other medicine-related questions. Thanks so much, Doctor.
You're welcome.
We've got to take a quick break. There's still more ahead on Talk of Alabama.